Hi guys, in today's video we're going to move on from the shoulder and move down the arm to the elbow. So today we're going to go over the structure of the elbow, so it's going to be a lot of anatomy. We're going to discuss the bones that kind of make up the elbow joint, some of the major osteology areas that are muscular attachment sites, and then we're just going to touch on some of the injury potential that the elbow has and describe kind of how the elbow develops as you grow. So let's take a look at the elbow from an anterior view. So let's remember anatomical position would be standing like this. So the thumb goes out laterally, the pinky comes medially, and the elbow joint consists of the humerus coming down, the radius laterally, and the ulna medially. Now when we talk about the anterior view and we look at it from this perspective, there's an acronym that can kind of help us remember the main osteology points that we want to remember. That acronym is CRITOE, C-R-I-T-O-E. It's kind of a dumb acronym, but it does explain the major osteology points as well as give a sequential order of when they develop when you're developing as a child. Okay, so let's start with the capitulum. That's that big C here. That is on the lateral side of the humerus, and it's kind of the spherical ball lined with cartilage. Everything in blue here is cartilage, and that connects to the radial head at the proximal portion of the radius. Okay, so we kind of have this capitulum on the humerus sitting in the radial head here. So in CRITOE, there's our C and our R. Okay, now CRITOE coincides with the ages 1, 3, 5, 7, 9, 11. So capitulum would be developing and ossifying at around age 1, whereas the radial head right here that the capitulum kind of sits onto and articulates with would develop around the age of 3. And again, these are general landmarks. Okay. Moving on laterally, we have the internal epicondyle. Most people call that the medial epicondyle on the humerus, so on the medial side here, and that's kind of that bulge outward, okay, on the distal portion of the inner humerus. Okay, that develops around the age of 5. All right, so 1, 3, 5. All right, and then moving on is the trochlea. So the trochlea is a little bit inward in compared to the internal epicondyle, so more in line with the humerus right here, again lined with cartilage and articulating with the proximal ulna. Okay, that develops around the age of 7. Next is the olecranon process. Okay, so we're going to move to the medial view to visualize this better. So you can see kind of this U-shaped cup over here, and this tip part here is the olecranon process. So that's kind of that funny bone area. You know, if you banged your elbow on something and you get kind of that numbness and tingling down your pinkies, you've hit the olecranon process, you probably disturbed the ulnar groove with the ulnar nerve, and you're getting some of those neurosymptoms out into the pinky and ring finger. So that's the olecranon process. It's only visible posteriorly. Okay, that develops around the age of 9. Lastly is the external epicondyle or the lateral epicondyle. So again, from anatomical position, this is on the lateral side of the humerus, and it's kind of that protuberance that bulges outward on the humerus. This is the attachment site for a lot of main muscles that we'll discuss later. That typically develops around the age of about 11. So outside of CRITOE, there's a couple other important aspects that we need to learn from the anterior view of the elbow. Okay, so first is the radial tuberosity. So this is kind of that protuberance on the radius, kind of sticking out here, and that serves as the insertion site for the biceps brachii muscle. That muscle is obviously it's a beach muscle, but it also serves to flex the elbow. So that's definitely an important attachment site there. And then across the way, we have the ulnar tuberosity right here. That serves as the attachment site for the brachialis muscle, which also helps to flex the elbow. Okay, so 2 very important bony sites there. And then connecting the radius and ulna is the annular ligament, which basically wraps the proximal portion of the radius and ulna kind of together and prevents forward, backward, and rotational displacement of the radius and ulna. So it kind of keeps them together as they rotate through all their ranges of motion. And that's really important, again, in terms of like athletic movements, keeping those 2 bones together so that we don't get dislocation, subluxation, things like that. Moving on to the lateral view. So I want you to look at like my elbow like this. We're looking straight into the elbow from that perspective. Okay, so the main ligamentous structures here that we need to know are the radiocollateral ligament. So that attaches the capitulum to the radius. Okay, so we are checking, or we're not allowing varus motion of the elbow. That means basically the elbow or the radius shooting laterally. Okay, so that radial-collateral ligament will do that. The other important point to know from the lateral view is that lateral epicondyle that we mentioned earlier. The lateral epicondyle serves as the main attachment point for all the forearm extensor muscles, okay? And that's typically the area that is kind of irritated when people say they have tennis elbow or lateral epicondylitis. It's that common tendon from the forearm extensors that gets irritated. So that's located right here. Moving on to the medial view, we can see the ulna and the olecranon process, again, kind of forming a wrench with the trochlea of the humerus. Okay, that relationship is really important. Again, they're united with that cartilaginous end piece together, and they kind of form that wrench to create more stability within that joint. A couple other bony osteology points here to know is the coronoid process of the ulna, which is located about right here, serves as the main kind of hub for the UCL ligament, or ulnar collateral ligament. The ulnar collateral ligament has three main pieces to it. It's kind of triangular shaped. So the anterior portion goes from the coronoid process to the internal epicondyle here. The oblique portion goes from the coronoid process here to the olecranon process over here. And then the posterior portion goes straight from the internal epicondyle down to the olecranon process there. And that UCL, it's a commonly injured ligament because it's preventing valgus force at the elbow, so the ulna kind of displacing this way. And it's a very common injury in throwers and overhead athletes, things like that. Okay, so that's definitely one you need to know. On top of that, we mentioned the internal epicondyle earlier. That's kind of this bony protuberance here. That serves as the main attachment point for all the forearm flexors. So when you hear people say they have golfer's elbow and stuff like that, it's typically those forearm flexors getting irritated and that tendon that inserts onto the internal epicondyle getting a little bit degenerated and irritated. So in terms of the elbow structure and all the bony osteology that makes up the elbow, that's pretty much the basics that you need to know for right now. So again, we know that the structure is going to dictate the function of the elbow. So now that you understand the structure, we can move on in the next video to the function and motion. If you like the video, make sure you comment, subscribe to the channel, and we'll see you in the next one.